Brenda is a mom living with her 3 children in a cramped apartment. The kids end up playing near the busy street since there is no yard to play in. Brenda has been on the wait list for Section 8 housing for a long time. She is a fictional character, but her story resonates with many San Diego families. A family resilience study used these stories to study childcare. Rebecca Fielding Miller is with the School of Public Health for UCSD.
What would the story look like if their child care center was a source of support for that? So tell us, imagine a world where where people are getting everything they need and childcare is really the center of that.
She says the study began weighing how parents were feeling after the height of the pandemic.
We worked with the California Department of Public Health and said, we really want to explore what's going on with parent burnout. And in particular, we're interested in the connection between burnout and childcare.
The study found parents with young kids juggling work and childcare were experiencing higher levels of burnout.
And now imagine some of the things that might stress them out. And, we heard the car breaks down, your hours change, an elderly relative gets sick.
Childcare was one of the factors weighing heavy on parents. Fielding Miller says she wanted to create a scenario where childcare helped parents instead.
And so we were really curious if childcare could potentially be a source of resilience and support rather than one more thing to be juggling. Imagine a world where people are getting everything they need, and childcare is really the center of that. Where the YMCA was piloting shuttles and, the kids could get a ride home from aftercare instead of having to juggle. What if there were drop-in resource navigators where you pick your kid up from school and somebody can also help you navigate CalFresh at the same time, and they're just always there and you can ask them.
Along with the San Diego YMCA and San Diego for Every Child, Fielding Miller presented the findings to policymakers. They asked what it would take to make something happen. Their response was a list of ideas.
So workforce rate reform, universal basic income, increased state support for childcare, mixed delivery universal pre-K, better parental leave, provider guaranteed income, municipal funding, and staff training and support for inclusive care.
Childcare reform hasn't happened yet, but Fielding Miller thinks her findings could play an important role in deciding policies one day. Tania Thorne, KPBS News.